It's a test most people don't even think about getting, but there is more proof that colonoscopies do save lives. A new study shows that removing the precancerous growths can prevent colon cancer. For more on this study and the benefit of the screenings, Dr. Aline Charabaty from MedStar Georgetown University Hospital is with us. Doctor, thanks for being with us. I appreciate it.
Thank you.
I have to say I was a little surprised to see that this is actually the first clear evidence that colonoscopies may actually help save lives. Wasn't that the case before?
Well, we always thought that by removing the precancerous growth, what we call the polyp on colonoscopy, and we're preventing the development of colon cancer, that would prevent death from colon cancer. But we never had a proof of it. And often things that we think are real and correct turn out to be incorrect in studies. For example, testing for PSA for prostate cancer didn't turn out to decrease mortality from prostate cancer. So this is a great study because I think for people who were hesitating in getting colon cancer screening and getting their colonoscopy, this is going to be very encouraging to know that it can prevent colon cancer and decrease death by colon cancer.
So the case here is that removing polyps improves the survival.
Absolutely. There's two important things to understand. One is that colon cancer is the second most common cause of death from cancer in this country. In this country, we're expecting in this coming year 50,000 people to die from colon cancer. But the second most important thing is that this cancer is preventable. It's one of the very few cancer that's preventable because most cancer develop from a precancerous growth, what we call the polyp. And when we perform a colonoscopy, that's what we're looking for. We're looking for a polyp. It looks like a mushroom. And by removing that polyp during the colonoscopy, we're preventing that polyp from turning into colon cancer.
And as I understand it, the number of cases of colon cancer have actually gone down because of the number of people getting screening now.
Absolutely. There's more awareness about colon cancer screening. We're able to offer colonoscopy to more people. There are other ways to test for colon cancer and colon polyps that are used. So the most important thing is that's happening is that there's increased awareness in the media, and also primary care physician, family practitioner, gastroenterologists are really discussing this with their patient and informing them about colonoscopy and the advantage of getting screened.
And Dr. Charabaty, remind us again, what age should routine screening begin?
So most patients will develop polyp after age 50. So the current recommendation is to start getting your colonoscopy when you turn 50. And if you don't have any polyps, then you can go on an interval of every 7 to 10 years.
But should there be, if there's a symptom, what symptoms should prompt someone younger than 50 to go get a colonoscopy?
Right. So if you have a family history of colon cancer or colon polyps, you do need to be screened at an earlier age. If you do have symptoms such as bleeding, a change in your bowel, whether your bowel becoming very thin or hard, constipation or diarrhea, abdominal pain, you should discuss this with your doctor, and your doctor might recommend colonoscopy. So anytime we have symptoms, regardless of the age, or if you have a family history of polyps or cancer, you should probably get screened before age 50.
Better to be safe than sorry. Dr. Aline Charabaty from MedStar Georgetown University Hospital, thanks for being with us.
Thank you.
The Fox 5 Weather app. Look 10 days ahead or hour by hour. View today's video forecast and radar that can pinpoint your neighborhood free at your app store or Android market.